So, hi, my name is Dr. Kevas.
Hi.
And today we will be conducting a cranial nerve exam. Is that all right?
Yes.
Okay, great. So, at first I'm going to ask you what is your name and the date of birth.
So my name is Rebecca Stone.
Okay.
And 15th of April 1980.
Okay, 15 April 1980. That's perfect. So what we are going to do today, first I'm going to look at your face. Okay, we will look for any ptosis, asymmetry or facial symmetry, which seems to be pretty fine. No muscle wasting, no salivating, that's great. Okay, loss of expression is also fine. There's nothing, and it seems like you don't have strabismus. Perfect. So then we are going to test sense of smell. So basically what I'm going to do now is that I'm going to take essential oils. You will close your eyes and you will smell the essential oil and then tell me what it is.
Okay.
Okay? Perfect. So I have there 3 kinds. So the first one.
I think it's cinnamon.
Yes. Now the second one.
Eucalyptus.
Yes. And the third. It's really hard to open it. Okay, so okay, now
Lavender.
yes, perfect. So it seems like your sense of smell is fine. You do not have any troubles with your smell, do you?
No, I think it's okay.
Yes. Okay. So now we're going to look at your optic nerves. We are going to look for or test visual acuity, visual fields, and then I will shine a really bright light into your eyes and I will look at like the back, like what is behind your eyes. So I will have to get really close. But first we will try the visual acuity and the visual fields. So visual acuity is a test where I'm going to take a book. It will be in this distance and you will read for me the first 2 lines.
The noise of the pony's hooves seems to muffled in the mist.
Okay, I think it's pretty much, it's pretty good. So the visual acuity seems pretty fine. Do you usually wear glasses?
Yes, I do.
Okay, and is it like meant for distance or close?
Both.
Okay, great. And which one is stronger? Like, do you see worse to the distance?
Worse to the distance.
Okay.
Yeah.
Are you planning any kind of surgery in
Yeah.
the future?
Yeah.
Okay, great. Okay, so now we will try the visual fields. I'm only gonna need my hands for that. You will like cover your eye with one hand. Okay, and I will do the same. And I will just move my finger and you will tell me when you stop see it, okay?
Stop.
Okay,
Stop.
okay,
Stop.
okay. And just look at me, straight at me, straight at me.
Stop.
Yeah? Straight at me.
Stop.
Good. Perfect. Now we will try the same with the other eye. So cover the other eye. Okay. look straight at me.
Stop.
Okay.
Stop.
Okay.
Stop.
Perfect.
Stop.
Great. Okay, so it seems like this eye seems much better than this one. Okay.
That's correct.
Okay. Do you have any problems with like seeing the space around you?
Yeah.
Okay. That's what I thought, because I have the same problem as you. Good. So we have the visual fields are done, and now we will focus on something behind me. Okay, maybe you can just look at the microphone that is in the distance. Now I will now take the light and I will shine brightly into your eye. Tell me if it feels uncomfortable. Okay, so first I'm going to look if there is constriction in your eyes, which means that when you look from like you're looking still at the point, I will just shine the bright light into your eye and your pupils constrict, which means that they become really smaller. Okay, so this eye works. Now the other one. Okay, this also. And when I shine a light into your right eye, your left eye will constrict as well. So now we will look at this. Perfect. That seems fine. I'm going to look like really up close into your eye, and if it feels uncomfortable, if your eyes hurt, just tell me, okay? Yeah. So I will just look. Okay. Now the other one. Okay, I'm looking at the vessels, at the visual discs, and everything seems fine. That's perfect. Okay. Now tell me, your eye. Yes. Now tell me, what color is this pen?
Blue.
Okay. What color is this pen?
Turkish.
Okay. So obviously the colors are different, right?
Yes.
Yes, perfect. Now cover your other eye. Again, what is this color?
Blue.
This?
Turkish.
Okay. Do you see the difference?
Yes.
Perfect. That's good. Okay. Now we are going to test. You will look at me. Now look at the pen and watch it get closer to you. Perfect. To the distance. Great. And again to you. Perfect. Great. Okay. Now look straight ahead. Look at me and do not move your eyesight anywhere. Now tell me, can you see the pen? Tell me when you cannot see the pen anymore, okay?
Now.
Okay. Any double vision? It means that you see it actually twice.
No.
Good. That's great. You should not see it twice, so yeah.
Stop.
Okay. Now here.
Stop.
Okay.
Stop.
Perfect.
Stop. Stop. Stop.
Great. Great, great, great. I'm going to again cover your eye. And I'm going to move my finger, and you will tell me which one moves, okay? So, can we?
Yeah.
Can you see this finger?
Yeah.
Okay.
Yeah.
You can point with your finger which one is moving. Like this. If I move my hand like this, you will point at this one.
Yeah, I understand.
Great. So,
This one,
good.
that one.
Mm-hmm. Perfect. Yes. Perfect. Now change your eyes again and again. Perfect. Mm-hmm. Perfect. Good. Perfect. Great job. Okay. So we've got that covered. Now we will try sensations, which means if you can feel sharpness and dullness of objects, or if just something like touches you. Okay, so now I will be actually touching your face with my hands and then also with objects, okay?
Yes.
Perfect. So I'm just going to take the object with me right now. So I will just ask you to close your eyes. Now I will just touch you, and when I touch you, I want you to say yes or yeah, okay?
Yes. 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 Yes.
Okay, I will touch you on both sides.
Yeah.
Did it feel the same?
Mm-hmm.
Okay,
Mm-hmm. Yeah.
perfect. Good.
Yeah.
Okay, now I'll touch you with the sharp, which feels like this. Can you feel it?
Mm-hmm. Yeah.
Perfect. And with dull. And when I touch you with sharp, I want you to say sharp. And when I touch you with dull, I want you to say dull or soft, whichever you prefer. So, okay, again, I will touch you with the sharp point,
yeah.
and you will tell sharp.
Okay, I understand.
And I touch you with the dull, and you will say dull or soft.
Soft.
Whichever you prefer.
Yeah.
Okay.
Yeah.
Because like soft is easily remember. Right. Yeah. So
Sharp. Soft. Sharp. Sharp. Soft. Soft.
okay. Perfect. Great. So we feel the same. Just gonna write the notes down. What we are going to do now is basically some funny faces. I will just have to see if your muscles feel like or feel work properly. Okay. I may ask you to blow out your cheeks like this. Okay, perfect. I will now touch you with my fingers and try to just gently push against the. Okay, so again, just blow your cheeks. Perfect. Perfect. Great. That's great. Now I'll ask you to clench your jaw, which means doing this. Like you are pressing the teeth against one another. Okay, I will just release and press again. Perfect. Again, perfect. So everything is working as it should be. Perfect. Now shrug your shoulders like this. Great. Now we'll just press against your shoulders, and you will just try to fight me, okay? Great, that's perfect. Now we will do the same with your face. I will press against your head, and you will press against me, okay?
Yeah.
So on one side Now the other. Perfect. That's good. Now could you just smile for me? Okay, open your mouth and stick your tongue out a little bit. Perfect. That's good. Great. So now we will try your ears and your hearing. So we will do some hearing tests. We will do Weber's and Renee's test, which basically means I'm going to take a tuning fork, okay, and I will press it into this and this area, and also at the center of your forehead. If you feel uncomfortable at any point, just tell me.
Yes.
Can you hear it?
Yeah.
Tell me when it stops. Yeah, may I ask you to close your eyes? Okay,
Now stop.
okay, and do you hear that?
Yeah.
I will do the same at the other side. Tell me when it stops.
Now.
Can you hear it?
Yeah.
Perfect. That is because the air conduction is much easily for us to hear than when we have the bone conducting. Okay, so this is good. Now we will try the same here. And tell me if you can hear it on the both sides the same, or does it like feel different at one side? The same?
Yeah.
Yeah, good. Perfect. I'm going to do the most fun part, which is actually looking into your ears. Okay, so this is going to be probably fun for me, but not so much for you. It can feel a little bit uncomfortable. I will ask you not to move while I'm like pushing this into your ear, because then we could hurt the eardrum. So just stay still. I'm a professional, I know what I'm doing, and I've done it several times, so you don't have to worry about anything. I will not go really far. I will just look if the eardrum is okay, if there is some kind of blockage, and if it's not causing any kind of like hearing loss, okay?
Yeah.
Perfect. I'll just look at your ear. Perfect. It looks completely normal. I can see the light reflex. Perfect. And the other. You don't have there any kind of blockage. I will just turn your head a little bit to the side here. Perfect. So I can easily access your. Okay. And that's great. Good. Again, I can see the light reflex. The ear canal is clean, so there is no need for you to go to some kind of clinic, you know. So that's perfect. Your hearing seems pretty fine. I will now whisper in your ear, really up close, and I will tell you it may be number or it may be an animal, and I want you to repeat it. Okay?
36.
Perfect.
29.
So the hearing is indeed completely normal. We will do something a little bit different. I'm going to listen to your heart. I will also check your pulse, and I will also examine your hands. Okay? So first of all, I'm going to just check for your pulse here. Okay, that's good. Now, I will look at your hands. Good. seems normal. Good. Now between the fingers. That's good. Now the other one. Again between the fingers. Good. So your wrists. Tonight. No itching, great. Itching means that no. Okay. Perfect. Good. So your hand seems fine. Now we'll just ask you to turn with your back to me. Okay, so now we will look at your back and if everything is normal, your spine basically. I'm going to press each and every vertebra. Good. Perfect. So the cervical spine is alright. Now we are at the thoracic spine. Good. And now we are going to the lumbar spine. Good. Perfect. So I'm going to measure your spine and how long it is. Okay. So we will start from here, from the thoracic spine, and it's about 48 centimeters. 48 centimeters long. Perfect. Good. Perfect. So, I'm just going to brush your back with. Okay, good. Now tell me if you can feel this.
Yes.
Yes.
Mm-hmm. Yeah. Yeah. Yes. Yes. Yeah. Yeah. Yeah.
Perfect.
Yeah.
Okay. Now we'll take a listen to your heart. To your lungs. Can you breathe in like really deeply?
Mm-hmm.
And exhale. And again. Perfect. Again. Good. Now we will listen to this. Okay, that seems fine. Perfect. Good. Good. Yeah. Perfect. Okay. So everything seems to be normal. I will now look at the skin. The skin feels normal. There doesn't seem to be anything dangerous, really. Okay. Perfect. Good. feel some of your muscles around the spine, the erectors. So the muscles are well developed. Now we will look at the trapezius. Okay. Good. That seems fine. Perfect. Okay, can you just put your shoulders a little bit back? Okay, so everything seems to be fine. Your eyes are, to be honest, quite the only problem. When you will go to the surgery, just let me know and we will check them after. So your hearing is perfect, articulation is fine, and all the cranial nerves work as they should. So
Okay.
thank you very much.
Thank you.
And have a wonderful day.
Yeah, you too.
Yes. Bye.
Bye.